Today, we are revisiting a foundational topic with a fresh perspective. It's called What is Autism in 2025? And I'm also going to give you 3 steps you can take if you have a child or client with autism or a toddler showing signs. Whether you're new here to the Turn Autism Around podcast or the YouTube channel or have been with me for over a decade, I hope you'll find this updated and expanded discussion informative and empowering. First of all, what is autism? Autism or Autism Spectrum Disorder is a complex bio-neurological and developmental disorder. That's a mouthful, right? It affects how a person perceives and interacts with the world. It encompasses a wide range of symptoms, skills, and levels of disability, which is why it's referred to as a spectrum. Symptoms of Autism Spectrum Disorder, or ASD, generally appear before the age of 3, although children can be diagnosed much later. Even many people are diagnosed as adults now. Autism impacts the brain's typical development in social interaction, communication skills, and cognitive function in some individuals. Individuals with autism typically have difficulties in verbal and nonverbal communication, social interactions, and play and leisure activities. Individuals with autism often suffer from numerous comorbid medical conditions, which may include immune issues such as allergies, asthma, and autoimmune disorders. I've talked previously on the podcast about PANS and PANDAS, which my son Lucas has. And individuals with autism also may suffer from neurologic conditions like epilepsy, digestive disorders, persistent viral infections, feeding disorders, sensory integration dysfunction, sleeping disorders, and mental health conditions. Truly a spectrum, with some individuals not speaking at all and demonstrating severe problem behaviors across environments, to some individuals with ASD becoming fully conversational, driving, graduating from college, getting married, etc. The latest diagnostic and statistic manual, which is the DSM-5, that was published way back in 2013. When the DSM-5 came out, it collapsed autism, classic autism, with PDD-NOS, which stands for pervasive developmental disorder not otherwise specified, which is pretty much more of a mild autism. It also collapsed Asperger's syndrome, all within the autism spectrum disorder diagnosis. This happened, the DSM-5 coming out in 2013, the same time social media was exploding in popularity, which led to some adults with autism becoming self-advocates, which led to controversy about all kinds of things, whether autism was just a gift, was just a neurologic difference. The media grab hold of adults who are fully conversational, and in the end, I think it ended up causing some issues with autism acceptance versus awareness, and the role of parents of kids like my son Lucas, who is intellectually disabled. He requires 24/7 care in addition to having moderate to severe autism. So all of that happened in 2013. Usually the DSMs are updated every 10 to 15 years. So we might be seeing a DSM-6 at some point soon. Also, what I learned when I was researching for this topic today is that the DSM-4 and before that were all Roman numerals. Now they changed it to the actual number 5. So we could also be seeing in the future more DSM 5 point something or 6 point something as we make changes, more frequently than every 10 to 15 years. But as it stands, ASD is split into 3 levels now. Level 1 is children and adults who have ASD require little support. Level 2 is people that need moderate support. And level 3 is children and adults needing substantial support. The DSM-5, as I said, is still standing, and it should be updated in the next few years. So we'll have to wait and see how that goes. But for right now, that answers the question, what is autism? So next question, what is the current rate of autism? Autism is diagnosed 4 times more often in boys than girls, and its prevalence is not affected by race, region, or socioeconomic status. Since autism was first diagnosed in the United States, the incidence has climbed to an alarming 1 in every 36 children in the United States. This is a study that's done every 2 years by the CDC, and it's done in 11 states where parents of 8-year-old children from these 11 states are called, and they are asked if your 8-year-old was ever diagnosed with autism. And I got the call when Lucas was 8, so I did participate. Pennsylvania is one of the states. So over the past 2 decades since Lucas was diagnosed, it's gone from 1 in 500 to, progressively worse. So I know this episode is called What is Autism in 2025? I think we're due for an update this year, potentially, or next year. So I'm sure the rate of 1 in 36 is actually going to probably trend to worse numbers than that. So that's the rate of autism at the moment. So next question, what causes autism? And this is a biggie. Over the decades, researchers have found up to 100 genes that could be at play, but no one cause and no one gene or environmental trigger. Based on the research on identical twins, fraternal twins, and siblings of kids with autism, it's not just genetic. If it was, it would be a, same DNA with identical twins. It would be 100% occurrence. It's not. It's up there in the 90 percentile above that. According to the NIH, identical twins do have a 96% chance that if one twin is affected with the diagnosis of autism, the other twin will have autism as well. But in this article that I can link in the show notes, even identical twins who share the exact same DNA can be on opposite sides of the spectrum, one being severely impacted at level 3 and the other one having, not a big need for support. Fraternal twins are similar to siblings and can have autism. If one sibling or fraternal twin has autism, the chances are 19 or 20%, which is 1 in 5. So it's really important that if you do have a newborn or you're pregnant, you can take part in studies around the country. If you're in the United States, they're called sibling studies. I've done some work on this. We can link that in the show notes, but you can also search for a sibling study that's closest to you if you wanted to enroll your baby. So we can link all that in the show notes. But in addition to genetics, which are definitely at play based on all the research, there are also environmental factors that are probably at play as well. And these environmental factors could include exposure to chemicals, toxins, or viral infections during pregnancy. Babies who are premature or very low weight are also have a much higher risk. I did a podcast on this. I've talked about this in my Turn Autism Around book. And, you know, it still is very much a moving target to figure out what is causing the rate of autism to continue to go up, and also the wide range of the spectrum and the symptoms. And there's agencies and organizations like Spark, which does a lot of research, which I have a really good interview with someone from Spark, which we can link in the show notes. It's so important that we all participate in research to make our lives and the lives of families with autism better. So next question is there a blood test or fetal screening or scans once a child is born to detect and diagnose autism? So the answer is no. Despite advances in medical science, there is no blood test. There are no scans that can diagnose autism. Autism is still diagnosed the way it was when my son Lucas was diagnosed more than 25 years ago. So diagnosis remains a clinical process based on behavioral assessments and developmental assessments and developmental history. So while I said that adults can get a diagnosis, a lot of times if a teen or adult presents for an evaluation to see if they have autism, we really need to look back to those early years where between 1 and 3, did they have signs of autism? Did they get early intervention and those sorts of things? In 2007, the American Academy of Pediatrics recommended screening in every pediatric practice using the MCHAT, revised MCHAT, at the 18-month and 24-month visits. I actually was involved with that. 2007 was the same time my first book, The Verbal Behavior Approach, came out. And I was involved with this big initiative throughout the state of Pennsylvania, educating pediatricians on the earliest warning signs of autism. And I was involved when that American Academy of Pediatrics screening, not mandate, screening recommendation, I would say, came out. So there is, getting back to the rate, there definitely is more awareness, less stigma, more need to early access of intervention, more help in the schools if you have a diagnosis of autism. So that is all definitely contributing to the rise in autism, but there still probably is more. So that test, the MCHAT, is free of charge. You can, I talk about it in my Turn Autism Around book. We can link it in the show notes. You can take it for free. It's 26 questions, I believe. Like, how does your young child respond to bouncing on your knee? Those sorts of things. Can they imitate? Can they point? All those, which we're going to talk about in a minute. So besides the MCHAT to screen, there are also more elaborate diagnostic tools, such as the Autism in Toddlers, screening tool for autism in toddlers, which is called the STAT, the Autism Diagnostic Observation Schedule, the ADOS, and the Autism Diagnostic Interview, revised. These are done by trained professionals and used to evaluate children who present with early signs of autism. So I know I drizzled in some signs of autism, but let's talk about the early signs of autism. Even if your child is already diagnosed, we're going to cover the 3 steps you can take regardless of diagnosis in a few minutes. But let's talk about recognizing the early signs of autism, because even if you have an older child or you work with older kids with autism, with the rate being so high, we do need to be aware of signs to help siblings, nieces, nephews, neighbors, friends, kids at the preschool, etc. Okay, so early detection of these signs allows for timely intervention and can really make a profound difference. I talk about the research of Ami Klin on a previous podcast, also in my Turn Autism Around book. But signs of autism in very young children can manifest in a variety of ways. Social communication deficits are number one. So even before a baby is supposed to talk, say at the first year mark, they're supposed to have a couple of words. But even children who don't speak yet, they should have joint attention skills. They should be bringing you things to show you. They should be starting to point, maybe around 9 months of age, definitely by a year. Definitely by 18 months of age. They should be pointing not just to things they want, but also to airplanes in the sky and things that are at a distance. Children with autism usually don't point with their index finger. They might reach out with their whole hand and that sort of thing. They also might do hand leading, which is grabbing your hand and putting an object they want. So pointing is a big thing to look at. I've done a lot of work on all of these topics. But let's talk about some other potential early signs. Limited eye contact, difficulty maintaining eye contact, just a general awareness when people walk in the room, when there's spilled milk or spilled water. Typical children, babies, toddlers will kind of look at the mess, look at you, wondering what we're doing here. Where a child with severe language delays and developmental delays, potentially autism, might just slap their hands in the puddle of water or milk and just be unaware that they should be looking for help or trying to solve a problem. Delayed language is almost always the sign that's going to get the most attention. Not just delays in spoken language, like not putting words together, not speaking enough words, but also not understanding or following directions as easily as a typically developing child would. So speaking also in scripts, lack of spontaneous communication, those are all potential signs. And then difficulty with social reciprocity, back and forth, taking turns, waiting, sharing. So that's all in there with social communication. And so it's a much broader thing than just, does your child talk? So the second big set of hallmark potential signs of autism or other developmental delays is restricted and repetitive behaviors, stereotypical movements such as flapping hands, rocking, spinning plates, lining things up, insistence on sameness, strong preference for routines, and I want to eat the Cheerios from the red bowl, or I need to use a special cup, or I need to use a bottle, even though I'm 18 months and we're trying to get rid of the bottle, insistence on going the same direction to the playground. And you might be thinking, oh, my toddler does that, but they don't have any of the others. A lot of these potential signs are very much occur in typical development as well. So you can have, a strong-willed child that really likes to take the same way. And, some very gifted children also have, insistence on sameness and not wanting to share. And, so as I'm reviewing some of these, don't think like it's definitely autism, because it might not be. Okay, so getting back to the restricted interests, focus on specific topics or objects or need to carry certain things around. And then sensory sensitivities, over or under reacting to sensory inputs like sounds, textures, lights. My son used to cover his ears a lot. And then imitation and play deficits, limited pretend play, and then also delayed imitation usually. So there's all kinds of ways to teach this. So we're going to cover that soon. So most babies and toddlers learn almost everything, almost every language ability and almost every play and social skill through imitation. So we definitely want to be aware of that. So let's talk about, really brief, some less common possible signs of autism, which I cover in chapter 2 of Turn Autism Around. And that chapter is called, is it autism, ADHD, or just a speech delay? And we go over the signs that I just talked about, but other signs that we didn't talk about yet that are in my book are potential signs: late walking, toe walking, some abnormal physical delays, picky eating, which I talk about a lot in chapter 10 of the Turn Autism Around book. There was a study in 2019 that highlights that kids with feeding problems that also have other issues that we just talked about are more at risk for autism, that feeding problems is actually one of the diagnostic factors and can be. And then finally, tantrums and other major problem behaviors to an extent where, it is concerning, could be a potential sign. Okay, so as I said, more information about these potential signs, chapter 2 of Turn Autism Around. You can read chapter 1 for free, listen to chapter 2, and get all the free book resources at turnautismaround.com, and or order the book on Amazon. We can link all that in the show notes. Okay, let's move on. We have a couple more questions, and then we're going to get to the 3 steps you can take regardless of diagnosis, severity, whether you're a parent or pro. So this question comes up about a decent amount. Is autism a lifelong disorder? So for many years, most of the definitions of autism did say that it was a lifelong disorder. But one of the most encouraging aspects of autism is the potential for significant improvement, especially when intervention begins early, even before a diagnosis. So for the majority of children who are diagnosed with autism as young children, yes, autism will be a lifelong disorder. But many children with severe autism that start out with severe deficits end up making tremendous gains and being on the other end of the spectrum. So really, even if you have a child who gets a diagnosis of level 3 autism as a young child, can make significant gains and may have very little deficits as they grow older. And while autism is usually a lifelong condition, a 2023 study done in Boston with 212 children found that over 37% of the children diagnosed between 1 and 3 no longer met the criteria for ASD when they were between 5 and 7 years of age. I'll link this research study in the show notes. I also did a podcast solo show where I described that study. That study is called The Persistence of Autism Spectrum Disorder from Early Childhood through School Age by Elizabeth Harstead, MD, et al., done at Boston's Children's Hospital. And after I did my podcast solo show where I described that study in full detail, I sent that podcast to Dr. Harstead, who said it was spot on. She loved it. And so that is a really good study to look at for, especially if you're out there and you're hoping that maybe this isn't a lifelong disorder for your child or clients. We are seeing some similar success in our online toddler group. We have parents of kids with and without an autism diagnosis making amazing gains. I wrote up a case study, with my mentor, Dr. Rick Cabina, in 2022. That is a white paper. It's at marybarbera.com/white paper, and it documents the gains on standardized testing as well as language samples with Michelle C's daughter, Elena. And that study documented her progress from 2 to 3 or 2 to 3-ish. But now Elena is in first grade without any autism signs or delays. In fact, she is socially advanced as well as gifted. So the sky's the limit with or without a diagnosis. And now let's move on to the 3 steps you can take starting today if your child or client has already been diagnosed with ASD, no matter what the age or severity level, and or if you suspect autism in your young child. Number 1, complete the Barbera Early Childhood Assessment. We call it the BECA, B-E-C-A. You'll get baseline scores and identify strengths and needs in 3 areas. First area is self-care and adaptive skills like eating, sleeping, potty, grooming, and dressing. The second area that the BECA will help with is language and learning skills. And the third area where you will get a score is in problem behaviors. So do the BECA, that's number 1. Number 2, look at the CDC early childhood milestones to see what level your child needs help at for each domain. Even if your child is older than 5 and has had a diagnosis for years, if they are functioning at an 18-month level or 2-year-old level for some area like expressive language, you'll have more information to help him or her. And if your child is delayed in the BECA and the CDC milestones and does not yet have a diagnosis, it's best to make a sick appointment with your child's physician or medical provider to get on a wait list and start early intervention. And the final step is, in my book, I talk about you as a parent becoming a captain of the ship, and also professionals helping parents become a captain of the ship. And this is really great. The subtitle of my book is An Action Guide for Parents of Young Children with Early Signs of Autism. With or without a diagnosis, you'll want to become the captain of the ship. And parents and pros can learn from reading my book, from attending a free online workshop, from participating in the BECA assessment, from joining my online toddler or school age course to get started. You're going to learn my 4-step Barbera method and the Turn Autism Around approach by doing any and all of these. So the 3rd step is really just to learn more about my approach. Half of our members in our toddler course do not have a child with a diagnosis of autism. Their kids are ages 1 to 5. Maybe they're on a wait list. Maybe they're just seeing signs. But we all know that we can begin to start turning things around and increasing language, decreasing problem behaviors, improving picky eating, sleeping, potty training, and so much more. It's a very positive, proven, and child-friendly approach, and I hope that you will learn more about it. Check the show notes. You can always go to marybarbera.com to get access to all my free resources and consider joining our online course and community where you can get the most help. I hope you enjoyed this video podcast. If you did, I would love if you would leave me a comment on my YouTube channel and share this episode with others. Let's have a great 2025, and I'll see you right here next week.